that the start? Imagine if you were walking down the street with your father and all of a sudden he clenched his chest in pain and fell to the ground. You ask him if he is alright, but he does not respond. Would you know what to do to help him in this situation? Today we are going to discuss what to do when you identify someone who could be in cardiac arrest. We're going to go over the steps to take and the proper order to take these steps. Do you know what you should do first when you see someone who is in cardiac arrest? According to the Mayo Foundation, the first thing you should do when you identify someone who is in cardiac arrest is dial 911. Dialing 911 has an ambulance coming to where the victim is immediately. By having the ambulance coming, they have vital medications for the patient that can help to restart the patient's heart. Also, the ambulance has electrical therapy that can help to jumpstart the heart. With having the ambulance coming, it means that the patient is going to have transportation to the hospital. By getting to the hospital at a quick manner, the hospital can check for an imbalance in the blood, which can be a cause of cardiac arrest, or simply a loss of blood. If a patient has a significant loss of blood, it could be the cause of the cardiac arrest. Now that help is on the way, we need to help the victim until the help arrives. According to About.com of how to do CPR, the first thing we need to do is check the victim's airway. We need to check in their mouth to see if we see anything they're choking on. If the victim is choking on something, we need to remove this to make sure that we can get air to them. Then we need to check the victim's breathing. When we're checking the victim's breathing, we need to make sure that we set our ear right above their mouth. We're looking at their chest to see if we see any rise and fall, listening for air, and feeling it on our cheek. We need to do this for a full 10 seconds. Also, after we have finished checking their breathing, then we need to check for their pulse. We need to feel their carotid on the neck. Sometimes it is difficult on the elderly or the young to find a pulse, so we need to make sure we do this for 10 seconds. If we're doing CPR on someone who has a pulse, we could be doing more harm than good. Now that we have established the airway and the breathing, and we have established that the patient does not have a pulse, we need to move on to getting the CPR started. We need to, according to the University of Washington of how to do learning CPR, we need to make sure that the victim is on a hard, flat surface, not on a bed that the victim is going to be bouncing around on. Once we have established that they're on a hard, flat surface, we need to make sure that we're going right in between the victim's nipples, placing hand over hand and compressing 2 inches down on the victim's chest, then releasing to let the victim's chest come fully back up. Once we have done that 30 times in a row, we need to stop and give the victim 2 breaths by mouth. According to CPR adult CPR steps, we need to make sure that we keep this at 100 compressions per minute. This means that we really need to move, giving them 30 compressions and 2 breaths per mouth, then moving back to the 30 compressions. We need to do this fast to get this up to 100 breaths per minute. After we have done 5 cycles of the 30 compressions and 2 breaths by mouth, we need to recheck the victim's airway, checking to see if they have anything in their mouth. Maybe by doing the CPR, we have dislodged the thing that they have choked on, if that is what their problem is. Then we need to check their breathing again, looking, listening, feeling to see if we can see if they're breathing. Remember, we do this for a full 10 seconds. After we have done that, we check the victim's pulse again, 10 seconds, to make sure that we haven't regained a pulse. Hopefully, with this knowledge in mind, if we see someone who is in need of help, you could be the one to give them that help. In conclusion, if we see someone who is in cardiac arrest, we will know what to do. Remember, the first thing we should do is call 911. By calling 911, we have that help on the way, which is vital to the patient's survival. They can bring medications, electrical therapy, and they get the patient to the hospital to be checked for the different things that could be causing their problem. Then, after we've called 911, we need to check the victim's airway, check for their choking. Then we need to look, listen, and feel for the breathing. And then we need to check for their pulse. Remember, when we're checking for their breathing and their pulse, we do it for a full 10 seconds. It's vital, because if a person has a large neck or they're elderly, it's going to be hard to find the pulse, and we want to make sure we're not doing CPR on someone who has a pulse. We're going to just do them more damage than good. Remember, after we've done the 5 cycles, that's 30 compressions and 2 breaths by mouth, we reassess the patient for those ABCs again, keeping the compressions to 100 per minute. So we need to switch up fast. Now that we have this knowledge in mind, if you identify someone that you love, or maybe even a complete stranger, and they have fallen with cardiac arrest, you could be the one to help them.